Are a part of the daily routines of millions of Americans. Some people take them because they have to. Some think it's going to make them healthier, but that's not always the case. We have Dr. Angela Tran joining us this morning.
Hi, good morning.
Always good to have you.
Let's have some fun today.
Let's do it. Okay, we were literally just talking. Supplements just seem like they're there. They're always just right there over the counter.
Yes.
You don't really think twice about it having any kind of benefit or effect other than it being positive. But why is that not always the case?
You know, supplements are really a big deal because they enhance your health.
Right.
They can really they can really just make you do things that can help you with your weight and your energy and things like that. But there are over 29,000 products out there right now.
That's a lot.
It can be challenging to understand what works, what doesn't, what's worth your money, and what's a waste.
Right. Okay. So what are the benefits of taking just one of those over-the-counter supplements, and what do you need to watch for?
Yeah, well, definitely, there are certain individuals that do benefit from supplements, from, those who have celiac disease, thyroid problems, even overweight individuals with metabolic disorders. However, supplements are not a ticket out of a healthy diet. And as a medical weight loss doctor, that's why we have an entire team to walk through patients on what their nutritional needs are.
And is there a concern of overdoing it, or especially I'm thinking the gummies, the ones that taste like candy?
Yeah, you know what? Unfortunately, supplements are really not regulated by the FDA, right? And so you need to consult your doctor because, these supplements can interact with the medications you're taking, affect your liver and kidney function, and even cause serious side effects such as bleeding. So you really need to be careful because there's so many supplements out there, you don't know what you're taking.
Right. Okay, that's really interesting. So they're not regulated by the FDA. How does that work when it's so widely available, though?
Yeah, because it's considered a food and not really a drug. And you need to watch the fine print. That's really what I recommend to all patients because, again, there are for example, weight loss supplements, fat burners, but they can increase your heart rate. They can interact with all of these other things. They can be really dangerous and even lead you to the hospital if you're not careful.
So basically, it sounds like at the end of the day, if you're looking to use this to help improve your health, you probably need to be talking to your doctor before you just go to the store and buy it.
Yes. And don't get me wrong, there are so many supplements that are helpful. My top 3. That my favorite. Everyone really should be taking a vitamin D supplement. It is helpful for your
Even
energy.
Here with all of our
Absolutely,
sunshine?
yes. Unfortunately, we are low on vitamin D. It helps with your energy. It helps with your metabolism. Number 2, magnesium. Specifically, magnesium glycinate. It regulates your blood sugar. It helps with bloating. It is a muscle relaxer. It also helps you with your sleep, so that's important. And finally, number 3, let's simplify, a probiotic. It helps with your gut health, so you can have really good digestion, especially if you're managing your weight.
Love it. Wait, all that sounds wonderful and all things that I could totally benefit from. Good sleep? Yes. Sign me up.
For sure.
All right. Thank you so much for coming in.
Thank
We appreciate
you.
it. We'll be right back.